I think at first glance, these numbers may not seem impressive, but I think any policy that can save about 800 lives a year can certainly have a profound effect over time. And additionally, I think this really, really only estimates life saved, and it doesn't account for those patients with cancer whose lives are truly improved by timely access to care and decreased medical bills and improved treatment options that health insurance can provide. I also think it should be noted that our estimate was truly the most conservative method for calculating the benefit of the Affordable Care Act. It's possible that the true benefit is higher, or that the numbers themselves will increase over time, as we're still very early on in the timeline for seeing cancer mortality benefits from the Affordable Care Act. I think that's a really good point. And yeah, I think that improved access to healthcare has both direct and indirect effect on cancer mortality rates. And I think we can expect that with longer follow-up, we may see even greater differences between states that did and did not expand. The Affordable Care Act has provisions, for example, for smoking cessation programs that they should be covered without cost to patients for those people who have health insurance. And the downstream effects of quitting smoking is huge in terms of cancer survival. The Affordable Care Act also encouraged preventative care, like cancer screenings, like mammography and colonoscopies. They encouraged that by eliminating copays. So for example, a woman with a newly acquired Medicaid insurance would be able to have a free cancer screening mammography, and the detection and treatment of an early stage breast cancer for her is then curative. The time course for that same cancer to grow and spread and ultimately take her life is typically years. And so the fact that we saw a cancer mortality benefit only over the couple of years that we studied is pretty remarkable. And as I mentioned before, the additional years of follow-up, I think, may show that this will only grow. Sure. When we plotted the yearly age-adjusted cancer mortality over time for the Hispanic population, we saw that the rates were very heterogeneous and that each year had a slight differential from the next. This was true especially when comparing the more constant curves from the other populations. And we do think that this has to do with the known poor access to healthcare in these patients, keeping in mind that to have mortality from cancer means that that person was actually diagnosed with cancer. And so that itself applies some sort of baseline access to healthcare, which may not be available in certain populations. So for example, a prior study has shown that Hispanic patients may have up to 3 times the rate of uninsurance as white patients. And so there are some members of that community that may be dying from cancer that we don't even know.